How has understanding of rosacea evolved? Imagine a skin condition that has puzzled doctors for centuries, showing up as redness and bumps on the face. That's what rosacea is, and our understanding of it has grown a lot over the years. People first described rosacea back in the 1300s. A doctor named Guy de Chauliac called it red lesions in the face, and used words like gouterose to describe the pinkish redness and couperose for visible blood vessels. Even then, stories from literature like Chaucer's Canterbury Tales and Shakespeare's plays showed characters with features like a bulbous nose, which we now know as rhinophyma, a subtype of rosacea. Back then, treatments were primitive and often harmful, like using mercury, sulfur, bloodletting, or leeches, because doctors didn't fully understand what caused the condition. As time went on, especially in the 1700s and 1800s, doctors started to classify rosacea more clearly. The term acne rosacea was first used in 1812 to separate it from acne vulgaris. They also linked rosacea to lifestyle factors like alcohol, but now we know alcohol triggers flare-ups rather than causes the condition. Over the years, doctors identified different types of rosacea, including redness and visible blood vessels, bumps and pimples, thickened skin, and eye involvement. These classifications helped improve diagnosis and treatment. Today, our understanding is much deeper. We know rosacea is a complex disorder involving abnormal blood vessel behavior, immune system activity, and even tiny mites called Demodex that live on the skin. Environmental triggers like heat, spicy foods, and alcohol cause blood vessels to dilate, leading to redness. Researchers have also found that certain sensory receptors in the skin are overactive, and the immune system reacts strongly, especially involving cells called mast cells and receptors like toll-like receptor 2. This immune activation causes inflammation and can worsen symptoms. The role of Demodex mites is still being studied, but they may trigger immune responses that contribute to rosacea. Diagnosis today is mainly based on clinical examination, but doctors now use classification systems to identify subtypes more accurately. Treatments have advanced from harmful remedies to targeted therapies. These include topical and oral antibiotics to reduce inflammation, laser and light therapies to address visible blood vessels, and skincare products that calm the skin. Despite these advances, rosacea is still often underdiagnosed, and many people aren't aware of the effective options available. Understanding rosacea's inflammatory and vascular nature is important for overall skin health. Chronic inflammation can weaken the skin barrier, making skin more vulnerable. Treatments like laser therapy must be used carefully to avoid damage. Also, because sun exposure can worsen rosacea symptoms and increase the risk of skin damage, protecting your skin from ultraviolet rays with sunscreen and protective clothing is essential. This highlights how managing rosacea isn't just about treating redness but also about maintaining healthy skin and preventing other issues like skin cancer. In summary, our knowledge of rosacea has shifted from vague descriptions to a detailed understanding of its subtypes, immune responses, and triggers. This progress has led to better management strategies that support healthy skin and reduce risks. If you think you might have rosacea, it's always best to consult a healthcare professional for personalized advice. Remember, every skin is different, and what works for one person might not work for another.